What were the highlights of 2020? Do we have to think about 2020? Yes, we do. There were some amazing things in 2020 in the world of cancer in dogs and cats. So we're going to talk about that. And what's cool about it is it's a preview of some of the exciting things that are going to be available for us as veterinary professionals and pet owners in 2021. Welcome to the final vlog of 2020. Thank goodness, right? I'm sure many of us are looking forward to turning the calendar to 2021. But you know, there have been some really amazing advancements in the world of cancer for dogs and cats. So I thought, as we're all looking forward to turning the calendar to 2021, let's review some of the really impactful things going on in the world of cancer for dogs and cats. And I think as we go through them, a lot of them are really almost previews of what's going to continue to impact oncology, in my humble opinion, in 2021. And a lot of these will actually be a preview of some of the upcoming vlogs that I'm working on. So let's do it. Let's break it down. Let's review and highlight what was taking place in 2020 and what is going to be going on in 2021. For me, hands down, paws down. I know that was a little bit cheesy, but seriously, I am so excited about the FDA approval of Stelfonta for the treatment of mast cell tumors. And we should expect to have Stelfonta in our practices in early 2021. And one of my first vlogs that I will be doing will be on Stelfonta. So we're going to dive deep into Stelfonta there. If you're looking for more information, I'm going to give you a little bit of an overview here, but at the end of 2019, I had the opportunity to go to Australia to treat some dogs with Tumor tiglate, which is now known as Stelfonta. This is an intratumoral treatment for mast cell tumors, for that common malignant skin cancer that we see in dogs. So it's injected directly into the mast cell tumor. It is not going to replace surgery, but it is another tool in the toolbox, another treatment option that we will have for dogs with mast cell tumors. In the new vlog, I will go through some of the requirements for it. There are definitely size limitations. It is for all grades of cutaneous skin mast cell tumors, and for subcutaneous mast cell tumors, they have to be located distally below the elbow or the hock. So there are definitely going to be things to know about. And they have to be smaller than 10 cubic centimeters. So again, we're going to dive deeper into that, but I think it is just so nice to have a new option for mast cell tumors, especially for those non-resectable mast cell tumors in difficult locations on the end of the legs, on the face. So I'm really excited about Stelfonta. And again, more information will be coming. That will be distributed by Virbac. It is made by an Australian company called Qbiotics. And again, just very excited. My number one thing that I'm excited about, it was FDA approved at the end of November of 2020. And like I said, should be available in veterinary practices in early 2021. I believe oncologists like myself will have it available first as they start the rollout. One of the things that you're probably wondering is, well, how effective is it? I will go through all of that in the upcoming YouTube video, I promise. But I have to give a little bit of information. I can't just go on to the next one without giving you a teeny bit of information. So we see about a 75% response rate at about day 28 after one injection. And for dogs that need a second injection, that goes up to about 85%, I believe. And if they look at dogs at 1 year, so the disease-free interval at 12 months after it, 88% dogs were still disease-free after that. So a very viable option for dogs with mast cell tumor. Be sure to check out the upcoming vlog in early 2021. So that is your reminder to subscribe so you will get notification when that YouTube video drops. The second thing that I'm excited about is a new blood cancer screening test from a company called Volition Veterinary. And the test is called Nu-Q Vet Cancer Screening Test. And this is a brand new thing that I'm premiering here. I actually did a Facebook post at the end of 2020 as well. This test will be launched in early 2021. That sounds weird to be saying. So this test is about to be launched and will be available to general practitioners. And this is a blood test that you as a pet owner may want to consider having run with your dog's annual blood work. And if you're a veterinary professional, you would consider running as well for middle-aged dogs. And so what this test is measuring, and again, I'm going to be doing a vlog next year as well on this, but it measures something called nucleosomes, which is part of the DNA, the chromatin inside all cells. And when there's cancer and other severe inflammatory conditions, this will get released into the blood. So we know that in healthy dogs without cancer, these score will be very low. And in dogs with certain types of cancer, the score will be elevated and high. So we can use this as a cancer screening test. And some of the cancers that the Nu-Q test is good at detecting are things like lymphoma and hemangiosarcoma. There's ongoing testing right now looking at some other cancers as well, like certain mast cell tumors and histiocytic sarcoma. So this is a really exciting test. The recommendations at this point would be something that you would consider for middle-aged and older dogs as part of their routine blood test. They do need to be fasted. So again, just something to be thinking about. You should be talking about it with your veterinarian in early 2021. Another use for the Nu-Q test would be high cancer risk breeds. So golden retrievers, Rottie, German shepherds, some of those breeds, you might even consider running the test earlier than middle age to older. So people always say to me, will regular blood work pick up cancer? And in general, no. Or why don't we have a good cancer screening test? So right now, looks like we're on the cusp of having that available for dogs. So really, really exciting. Stay tuned for more information. Be on the lookout for a new vlog. If you're a veterinary professional, you can go to the Volition website. Even if you're a pet owner, they have a ton of information, videos. I'm doing some consulting for them. So they have pet owner brochures and veterinary information as well, videos and things like that. So stay tuned for more information. Like I said, you can go to their website and I'll put some links below as well. The third thing that I'm really excited about is Tenovia, which is one of the lymphoma drugs. It's not brand new for 2020, but what I'm really impressed about Tenovia, which is a chemotherapy drug for lymphoma, is how I'm turning to it more and how I'm using it more in my practice. And it's still conditionally approved, so it's not fully yet approved, but it's getting there. And it really just has made such an impact in the treatment of lymphoma. And as more studies are continuing to be done, I think it's going to evolve the way that we're treating dogs with lymphoma. So the standard of care, and we'll put links below to my lymphoma videos, is still the CHOP multi-agent chemotherapy protocol. So it's not Tenovia, but Tenovia has quickly moved up as part of my Plan B protocol. For dogs with B-cell lymphoma, historically I would treat them with single agent doxorubicin, and now I will often treat with doxorubicin alternating with Tenovia. And my first line rescue protocol for a dog that fails CHOP chemotherapy is Tenovia. So, and we're learning much more about it. And so I'm just really excited, and I think it's really just made such an impact in lymphoma treatment in dogs. So I do have more videos, of course, about lymphoma. I actually recently just did a summary video about that. So to me, it's just something that I'm reaching for more, and there's been more studies about, and it has really just made such a positive impact on the treatment of lymphoma. And since it's one of the most common cancers that I treat, day in, day out in practice, I'm excited about it. And like I said, even though it's not brand new, it continues to make an impact on my daily practice and positive impact on the dogs that I'm treating, and it had to include it in the list. My fourth thing that I want to talk about in my review of 2020 is immunotherapy. We're seeing more immunotherapy treatment options come into play for dogs and cats, mostly dogs at this point. You know, we also saw an update on one of the immunotherapies, which is no longer available. And that's also a good reminder that just because there's new therapy available doesn't mean that it's going to be the end-all be-all, or that it's something that we should adopt current standard of therapy and try new therapy. So just really important. I know people always want what's experimental, what's new, but it doesn't always mean that it's the best. We have to do those clinical studies. We have to make sure that the data shows that these treatments are effective and safe. So the one immunotherapy that's no longer available based on some, updated safety studies was the immunotherapy, the canine osteosarcoma vaccine. And that was based on the results that showed that there were some listeria side effects. It's an attenuated listeria vaccine. And as some results came out, they were seeing some listeria positive dogs, and the vaccine was originally being developed by Aratana, which was then taken over by Elanco. And in January of 2020, it was announced that they would no longer be developing the vaccine. And then just in October, we got some more updates about that. So that was very sad news, because it did look like this immunotherapy, which is a treatment for dogs with osteosarcoma, I had been super excited. And this had been in other videos that I would, I'm super excited as I get really excited about these new treatments. For dogs that were getting amputation and chemotherapy, this immunotherapy was delaying metastasis. So very, very exciting. But, now we're seeing these safety issues that dogs were getting sick, and there were, positive cultures. They were getting listeria infections, and also there was concerns about zoonotic potential. So the owners getting listeria, infections as well. But I'm still excited about immunotherapy, and I do think it still has the potential to make positive impacts on treatments of cancer. One of the other immunotherapies that we've been using for years safely is the melanoma immunotherapy vaccine for dogs with oral and digit melanoma. So that's been available for over 10 years. Another new immunotherapy that I'm excited that there's some good evidence coming out is by Elias, and that's a cancer immunotherapy. It's an adoptive cell therapy, and they just published some studies, and these were dogs that had amputation, no chemotherapy, and then went through this immunotherapy regimen. And in a recent study of only 14 dogs, I realize that's a very small number, the median survival time was 415 days, over a year. So without chemotherapy. And so traditionally we think, dogs need chemo after their amputation to extend their survival beyond, 4 to 5 months. And there were 5 dogs in that study that lived greater than 730 days. And so that was just published by Dr. Flesner et al. In the Journal of Veterinary Internal Medicine. So very exciting. So again, maybe we'll have new immunotherapy options for dogs with osteosarcoma. So very exciting. That's my, my topic on, what's exciting and new, I think, is immunotherapy. But again, we have to, as we get new data, we still have to analyze it, make sure it's safe, do larger clinical trials, and make sure not only is it effective, but safe as well. But this is the one that I'm excited about. Again, this is the Elias Cancer Immunotherapy, and I plan on doing another vlog for you as well, and hopefully something that I'm going to start to get involved with in my practice as well. So stay tuned. I'll be sure to give you more information, and you can check out their website as well if you're looking for more information. What else has made such a positive impact in my practice this year? Not just this year, but inappetence medication. And I actually have these at home, and I don't even have dogs that are on chemotherapy. But Entice for dogs, this is a ghrelin agonist. So ghrelin is the hunger hormone. It mimics the hunger hormone and makes dogs that are not wanting to eat think that they're hungry. And Serenia, an anti-vomiting nausea medication. So I actually always have these on hand at home for my Labradors in case they're sick. And if you follow me on Instagram, I have lemons. Penelope is a lemon. And for cats, there's Mirataz, which is mirtazapine, which is a topical, so you don't even have to pill your cat that doesn't want to eat, a topical medication. And for 2021, the makers of Entice, they are going to have an FDA approved version for cats, which is great as well. So another inaptitude option for cats. And even though I love Mirataz, which is a great one, sometimes your pet needs more than one medication. I'm going to put a link to my vlogs on what to do when your pet doesn't eat, because it's so important. That's one of my things I feel so passionately about, is what to do when a pet doesn't eat, because when they don't want to eat, it's stressful. And it's important that we have medications that can help them during those times when they don't want to eat. If they're a chemotherapy patient, a cancer patient, a pet with kidney disease, heart disease, so many different things can cause inappetence. So these medications have made my life as an oncologist so much better, because pets will eat more and, we can support them through their treatments. So just so important. Obviously these are not just new to this year, but things I'm reaching for on an everyday basis. So impactful. And I'm thankful that I have them. And if you have a pet that's going through chemotherapy, make sure that you have them on hand. I'll put links. You should be going home with them on day 1 of your treatment. Dogs and cats should go home with my goodie bag of recommended medications. We'll make sure I put a link to that blog as well. As much as I would love to ignore COVID, I don't think we can have a review of 2020 without talking about COVID-19 and how it has impacted our lives as veterinary professionals, as pet owners, and just people in society. And so, it's been a scary time, right? Because the concern of how COVID would be transmittable to pets. Could we get it from pets? Could we make our pets sick? So such a scary time on so many levels. Quarantine, social distancing, wearing masks, all those different things have really just, it's hard to even sum it up. But I think one of the things for me as a veterinarian that has been so hard is curbside check-ins and not being able to be in the exam room with my clients, especially when you're talking about cancer and cancer coming out of remission and talking about different treatment options. And for pet owners, waiting as I'm doing chest x-rays and ultrasound and doing different diagnostics. And I know you're waiting in the car and just how scary it is. And I just really look forward to getting back to normal, getting back into the exam room face to face with my clients. And I just know how hard it has been for pet owners to go through this, for veterinary professionals who are watching. Thank you for all that you're doing, technicians, everybody out there, the entire team at practices. This has been a very challenging year. It's been an exhausting year on so many different levels. I'm actually dealing with COVID in my household right now, so it has been a very tough, trying year. I am looking forward to 2021. I'm looking forward to more advancements in oncology. I am looking forward to helping you navigate this crazy world of cancer and just getting through it all. So without getting too emotional, thank you so much for your love and support. See, I'm going to get emotional. I almost stopped vlogging this year because it has just been a lot. So thank you for your love and support. I really can't believe it. I really appreciate you and all that you do and your love and support. I said that already. Thank you so much for watching. Stay tuned in 2021. I have a lot planned. Keep sending me your feedback. Some people have given me some great suggestions. I have a list here of different topics that we're going to cover. Who knows what will be thrown at us, but we'll get through it together. Have a wonderful holiday season. Stay safe, stay well, and I look forward to seeing you back at the next vlog.